Bismillahir Rahmanir Rahim. I welcome you all with the Islamic greetings. Assalamu alaikum rahmatullahi wa barakatuh. May peace, mercy and blessings of Creator of the universe, Allah subhanahu wa ta'ala, be on all of you. Myself, Dr. Ahamad Shaikh, PhD, DSc, Doctor of Science, Head of Chemistry Department, Maharashtra College, Mumbai University, President, Islamic Vision Research Center. Today I will share with you regarding coronavirus disease, COVID-19. According to World Health Organization, WHO, coronavirus is a family of viruses which may cause illness in animals or human beings. In human beings, coronaviruses cause respiratory infection from common cold to severe diseases like Middle East respiratory syndrome and severe acute respiratory syndrome. Most recently, coronavirus disease called COVID-19. It is an infectious disease which was noticed for the first time when the outbreak began in Wuhan, China in December 2019. Now it has spread almost all over the world. Hence, on 11th March 2020, WHO declared it as a pandemic. If the disease is localized, it is called epidemic. When it is globalized, it is called pandemic. Coronavirus disease, COVID-19, is a respiratory illness like flu. The symptoms are fever, tiredness, dry cough, and in some cases it causes difficulty in breathing, runny nose, sore throat, nasal congestion, diarrhea, etc. These symptoms are very mild and begin gradually. Some of the peoples being infected, but they do not show any symptoms. They also do not feel unwellness. Most of the people, about 80%, recover from the disease without any special medical treatment. 1 out of every 6 infected person develops a serious illness. The symptom appears within 2 to 14 days and the recovery is within 2 weeks, and in severe cases the recovery takes 3 to 6 weeks. Old people and the people having medical background of heart problem, diabetes, high BP, asthma may have chances of severe illness. As far as children are concerned, the cases are very few, but WHO has given advice that people of all the ages must take utmost care and prevent themselves from the virus through good hand hygiene and good respiratory hygiene. According to Johns Hopkins University report, the virus is not a living organism. It is a protein molecule DNA. Having a very thin coat, very thin covering of lipid, that is a fat. The virus enters through eyes, nose and mouth. And moment it enters in the body, through these passages, it undergoes genetic coding, and that is called mutation and becomes active and starts multiplying. The virus spreads through liquid droplets while sneezing, coughing, and exhaling from an infected person. The people who are in the close vicinity, the virus enters through their eyes, nose, and mouth in the body. That's why social distancing is must. One should keep away at a distance of 5 to 6 feet because one does not know whether the person is infected or not. That's the reason why. While coughing, sneezing or exhaling, one should cover the mouth and nose with the tissue paper and throw away the tissue paper immediately at the safest place in the dustbin. Or you must put your hand bent elbow on your mouth and nose. It is noticed that when the infected person sneezes, coughs or exhales, the liquid droplets contaminate the surrounding area, the close vicinity, the articles as well as objects. When the healthy person touches it and touches the eyes, nose and mouth, the virus enters through these passages in the body and he gets infected. That's the reason why the person where he sits, where he lives, where he stands, that place should be sanitized, that place has to be disinfected. And the person must use hand gloves to avoid the hand contamination, and one should wash the hands with sanitizer or soap. It will be better if he or she is using warm water because it will produce more foam. The foam will cut the upper layer, upper coat of lipid of the virus. Then virus disintegrates on its own. The rate of disintegration of virus depends on temperature, humidity and the surface on which it is deposited. That's the reason why one should frequently and thoroughly wash the hands with sanitizer or soap with warm water, minimum for 20 seconds with fingers in, finger in and thumbs. One should use mask. Don't touch the mask from the front, put it from the rear side. And it will be better if you put on the mask with your washed hands. And after taking out the mask, you should wash your hands. This is the way how we can protect ourselves. One should remember that one should not come out unnecessarily from the house. One should follow the total lockdown. At the same time, one should not gather at public places like market, shopping malls, schools, colleges, universities. Gatherings should not invite the friends, should not invite the guests, should not gather together in groups, should not play cards, should not play carom, should not play cricket. It's better that save yourself, save your family, save the society, save the nation, save the country. Because social distancing, good hand hygiene, good respiratory hygiene, and if you are having symptoms, isolate yourself, go in isolation and quarantine. These are the only remedies at this moment. Secondly, we can be safe through dietary. We can protect ourselves through boosting the immune system using good diets rich in vitamin C, like orange, lemon, grapefruits, gooseberry, which contains maximum amount of vitamin C. Apart from that, apple, papaya, kiwi fruit, sunflower seeds, garlic, salted onion. The king of fruits, dates, along with that honey, clove, black cumin, that is called kalonji. But Prophet Muhammad said that black cumin has got cure for all the diseases except death. So one should take 10 to 15 grains of black cumin. So by this way, by using proper diet, boosting the immune system and taking utmost care, which the scientists, doctors, health organizations and governments are giving, if we act upon it, inshallah, God willing, we will be saved from COVID-19 and we will win over COVID-19